Hello and welcome to Maternal Mental Health Awareness Week, where we are celebrating year 10 with our theme, A Decade of Voices. My name is Eve Callum, I'm one of the co-founders of the week, and for today's information session, we're meeting with our good friend Victoria, who we love doing things with, from the organisation ND Birth. I'll pass over to Victoria in a minute to introduce herself and the work of the organisation, but just before that, I'll do my little safety warning that I do at the start of all of these. So this session between Victoria and I is purely for information. Anything that we talk about here should not replace any advisory information that you receive from your own healthcare professional, be your midwife, health visitor, GP, doctor, consultant, perinatal mental health team, or anybody else. And so with that, hiya.
Hello.
Victoria and I
I
are
was
mates, we
nodding
like
along
this.
thinking, gosh, yeah, this is, yeah,
Yeah,
absolutely.
so there you go.
Yeah,
And so Victoria, I know you. People at home, introduce yourself and what ND Birth is.
sure. Okay, thank you. Thank you for having me and congratulations on 10 years. It's
Thank
absolutely
you.
amazing. It's
I
absolutely
know, I
amazing.
know.
So good.
Thank you.
Feel a bit giddy. Yeah, so my name is Victoria White and I'm the founder of a not-for-profit social enterprise that's called Neurodivergent Birth, and we're a CIC, which is a community interest company. And we exist to improve this support and understanding of neurodivergent people as they navigate the perinatal time. We do that in a few different ways. The first is that we have training, it's CPD accredited training, and that's for midwives, doulas, anybody really who's working with people perinatally on supporting neurodivergent people and their experiences. And we have antenatal education that's pre-recorded, it's online, it's designed specifically for neurodivergent audiences. So it covers everything you'd anticipate antenatal education to cover, but always through the lens of neurodivergence. So we're always coming back to what our rights are in terms of our rights to reasonable adjustments. We're always coming back to our sensory experiences, supporting our communication needs, our executive functioning needs as well, and mental health through the lens of neurodivergence, because a lot of us come to this time of life as neurodivergent people, perhaps with having difficulties with mental health along the way due to lots of different reasons, but in a nutshell, trying to navigate the world, which is set up very much for neurotypical people as a neurodivergent person. So I myself have an autism diagnosis and an ADHD diagnosis. I wasn't diagnosed till I was 41, so I'm still very much processing that and still kind of, yeah, working out what that means in terms of sort of identity and looking back on my life so far. And my daughter, my 9-year-old daughter, Thea, is the reason that the organization exists because she was diagnosed as autistic and has ADHD. And she was diagnosed at the age of 5, which is pretty much when neurodivergent birth came to be. Yeah.
Oh, thank you. So you've answered my first question. I was going to ask how the
Sorry.
organisation started. No, I'll tell you why. And for people at home, if you go on the website for ND Birth, it is so beautiful because Victoria talks about the story and the background and as to why the CIC was started.
Yeah.
And it's, I think, having been in the kind of perinatal world for about 14 years now, my son's 16, yours for me was the first organization that I've seen of its kind. And I remember we probably connected about 3 or 4 years ago. I can't
Yeah.
remember, 3 years ago.
Yeah.
And I was so interested in the work that you do because we had started to get questions coming through to our inbox. And when we do our survey each year about, what people like us to cover, and
Yeah.
people were saying, I've had quite a late diagnosis
Hmm.
of autism or ADHD. I'm navigating my first pregnancy, though. How can I get help and support? Could you shine a light in any organisations that do this? And for a couple of years, we were like, not
Yeah.
sure. And then your organisation popped up, and I think it's been so good. I think over the last few years, I see you giving your time so graciously to other organisations and supporting them by bringing your work to them and kind of to inform them, educate them, encourage them. And I think it's been so wonderful how you are kind of stretching yourself to kind of get this into the minds of everybody. And so I think that's why it's been so important that each year we now do something with you, because it is so important that we are thinking of all families,
Yeah.
all families. And I think I know from, well, when you looking at the website about the things that you offer, and we'll touch on that in a minute, but then the feedback that I've heard from people, the way you've delivered workshops too, is incredible. And so I think real kudos to you for starting the CIC and
Thank you.
producing the things that you do, to support people. Because it's wonderful. And I think, from that, I wanted, my second question was going to be ND birth. So you do your workshops, you do competency workshops for
Yeah.
birth workers. Give us a little insight into what they are, who
Mm.
they deliver to, and how people can access them or request one.
Oh, thank you for everything you've just said, which is, and before I do that, I suppose something that you said really stuck with me there in terms of kind of bringing the conversation to everybody. And I think that is so important because it can't be like an add-on. It's not a luxury to ask for reasonable adjustments. And actually, if you think about the fact that potentially 15 to 20% of the population is neurodivergent, so anybody working in this space is working with neurodivergent people. And we're very much still in the space of not often understanding our own neurodivergence, perhaps until later in life. So we may very well go through the whole perinatal period without that understanding. So we're not going to be sat opposite people who are saying, I'm autistic and therefore how can you help me? That will happen sometimes, but the majority of people that you come across who are neurodivergent may not disclose or they don't have that knowledge themselves. So the awareness piece in all education, antenatal education, all perinatal support, all perinatal mental health support is so important. So yeah, that really struck me. So our workshops, we have a kind of a standard, I suppose, CPD workshop that's 6 hours long. So we hold it over 2 days, and that happens every month online. Anybody can sign up for it, um, and it covers what we call the four support pillars of neurodivergent birth, because we really wanted to make sure that we weren't just talking about this is the autistic experience, this is what it's like if you have Tourette's, this is what it's like if you're dyslexic, because everybody's experience is so different, so individual. And also, a lot of people will identify as having co-occurring things going on, like myself, autism and ADHD, and what does that mean? So it's really important to kind of not go down the silo into looking at the silos of the labels, I think. So we talk about these four support pillars and they're the themes that we focus on. So they're sensory processing, communication, executive functioning, and mental health. And the reason we focus on those is because a lot of neurodivergent people will experience some differences, some positives too, but quite a lot of challenge within those areas. And also, those areas are so impacted by becoming pregnant, giving birth, and starting a family. If you think about just take one of them, the sensory processing experience of pregnancy, your body changes so much. You might be experiencing all those kind of hormonal shifts in a different way. You've got nausea potentially, and in many cases, very severe sickness. And then we've got how we feel about our babies moving within us and that sort of thing. So the list kind of, we often have that mind blown moment when we think about, okay, like pregnancy, birth, and the postnatal time from a sensory perspective, it's huge. So we do that every month, as I said, but we also increasingly work with organizations to do bespoke workshops. So for example, we'll go and train teams within organizations. We've done training for the team at Pandas Foundation, at Make Birth Better, at Becoming Families. And we're increasingly working with the NHS and going into their maternity units and speaking to their midwives there as well, which is amazing. Really good.
Oh, wonderful. And if people want to sign up for the workshops or request a bespoke one, how do they do that? Would it be through the website?
Yeah, so ndbirth.com. I'm pointing
Fancy
to my
like.
flashy neon sign because I like brightly colored things. Um, ndbirth.com will have our monthly online workshops on, and you can sign up at any time. But yeah, if you're looking at for something bespoke for your organization, you can contact us through the website, which will go to our email address info@ndbirth.com. And there's
Lovely.
nine
And
of
that'll be
us
in the
now.
caption.
Yeah, that'd be
Nice.
amazing. There's nine of us now delivering the training. It used to be just me, and I'm really pleased to say that it's not just me because I really want that diversity of experience. So everybody on our team is neurodivergent themselves. They all bring different lived experience to the conversation. And we're absolutely not, experts. We're not saying, and we're not clinical. Well, some of us are clinical, I should say. Some of them are midwives, but we're not coming at it from a position of expertise. We're facilitators of the discussion. We, facilitate the exploration of these pillars of these topics, and importantly, what we can do to support people within these themes. And that's when we look at the Equality Act in the UK and what reasonable adjustments can look like. And the main message being we're there to support people as professionals to make adjustments. And often it's very small adjustments that make really big differences for people.
This is brilliant. I think to see how the team has grown shows actually the desire for people to learn more, to
Yeah.
be as inclusive as possible and to give people the best chance. So when the Equality Act is there for a reason, reasonable adjustments are reasonable, to support people. People
Yeah.
should have things adjusted to support them, you know, in the workplace, in life and beyond. And I think it's a real kudos to the work that you're doing, that the appetite is continuously growing,
Yeah.
for it. So thank you for what you're doing in this
Oh,
space. I
thank
think it's
you.
brilliant. No, honestly. But also you have your podcast as well.
Yeah.
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 And you have you do loads of really good things, Dick. So I listen to it. So yeah, give us a bit of insight into the podcast.
I love our podcast. It's now and I've realized how much I like yapping, and that's that's good. When we started out, it was the bit that I was probably a bit it was really out of my comfort zone to be on a podcast, but I did it anyway, and now it's the bit that I really look forward to. So we're in our fifth season now, and we cover so many different topics. Mainly, we speak to people about their lived experience, again, lived and living experience of being a neurodivergent person and being pregnant, giving birth, navigating the postnatal time. But we also talk to professionals as well. So, share best practice on what good support looks like. And we talk to autistic researchers who are doing PhDs on this topic. For example, the Maternity Autism Research Group. Most members have been on the podcast because I love talking to them because it really appeals to my kind of sciencey, nerdy brain that wants to know all about the research. But there is amazing research going into this topic, and yeah, they share that on the podcast as well. Our fifth season is called 8 Weeks to Prepare for Your Neurodivergent Birth. So every week we cover a different topic, and it's nice and short, snappy 20-minute episodes. We look at everything from preparing for antenatal appointments as a neurodivergent person to communicating your support needs. We're looking at infant feeding from the neurodivergent perspective and mental health as well. So yeah, each week, one of my lovely practitioners in the wider team that I was just talking about comes and chats to me about one of those topics. So that's been really, really fun to record.
Oh yeah, and they're great to listen to. I listen to them, they're really
Thank
good.
you.
And I feel like I've learned so much from them. And it's like why we do these information sessions, because people come to us and go, well, I didn't know that. So
Yeah,
we have people at home who are poorly, family members who are supporting them, friends, work colleagues, line managers, that like saying, oh, I didn't realize these things, but then healthcare professionals. And I
yeah.
think the work that you're doing to inform people, which ultimately helps support, is brilliant. So yeah, give a listen to the podcast because it is really good. And you've had some great people on.
Yeah, we've been so lucky. People are so
Yeah.
generous with their
I know they're so generous
time.
with their time.
Yeah, it's so
Yeah,
amazing. Like I
I think
think
it's
when, yeah,
lovely.
the passion really comes through in the podcast as well. So I hope people enjoy that
Yeah, I
side of it.
agree. I agree. What's next for you then, Victoria? Because I feel like you've
Um,
worked so in the past 3 years. You've been is busy the right word?
yeah, I don't really know.
You've been
Uh,
busy.
it has been busy, yeah. It's been wonderful though, and I'm so
Yeah.
grateful to the wider team. It's not just me anymore. My co-director, Joe Reese Davies, is one of my favorite people on the whole planet, and we have a lot of fun as well, and we get to indulge our special interests, to be honest, on a daily basis. But yeah, in terms of what's coming up, so at the moment we launched during Neurodiversity Celebration Week a campaign called Think Neurodivergence First. And that's really about people recognizing that often neurodivergent traits or ways of being are misread, they're misunderstood, and they might be interpreted as something negative, assumptions might be made about that person's ability to parent potentially. If you're seeing a slightly different parenting style or a different way of being, a different way of communicating, then sometimes those are seen negatively and may even be seen as potential safeguarding issues. And people are referred on to social services simply because their way of being doesn't meet expectations of what people think it should be. So we're just encouraging health professionals to think neurodivergence first, which is really asking people to just pause and think, okay, is this way of being, is this difference that I'm seeing an unmet need? Is there an unmet support need here? Or is there a sensory sensitivity or a communication difference perhaps going on that rather than a cause for concern or a need for intervention or any risk per se.
Mm.
That's not to say there won't be risks sometimes. We're not saying that there's never a risk with a neurodivergent parent involved, but we're just asking people to pause and be curious first before making those assumptions. So often I've heard of people who are neurodivergent being labeled as difficult, and that's just so disempowering. It's so stigmatizing, and it really then impacts how they are treated once that kind of label's been given to them. So yeah, that awareness piece is really important to us. So you can download an information sheet on our website about that. And if you would like to, you can purchase a lanyard pin, which says Think Neurodivergent First on it. And that then, communicates to people that you are thinking about it and you are a safe person to talk to about these things as well. The other thing that's coming up, I mean, it's quite far off, but it's very much on my mind, is Neurodivergent Birth Awareness Week. So we launched this for the first time last December, and everyone said to me, "Why December? This is the worst possible time of year to do anything." And I apologize, but we wanted it to coincide with my daughter Thea's birthday because she is the reason that neurodivergent birth exists. So it's from the 5th to the 11th of December. And last year it was so much fun. We sent resource packs out to NHS trusts. We sent tea and coffee and biscuit vouchers, and people had really amazing conversations in the workplace, on the maternity ward, on the postnatal ward about how are we supporting neurodivergent people in these spaces. And oh my goodness, I can't kind of emphasize enough how exciting that was to see that happen. So we're going to do it again this year, but we're culminating all that with an online conference on the 11th of December. We've already got some amazing speakers lined up for it. So there's going to be various options, including free to attend options if you come live on the day. Then if you want the recordings, they'll be paid for options as well. So watch this space because at the moment it's mainly in my head. And it needs to actually.
Welcome to my world.
Yes.
I had like all my notes are on like pieces of paper like this, so
Yeah.
yeah, and flashcards like
I know you
this.
can relate. I know you can relate.
And I'm sitting in my son's box room computer room because everyone's sick and it's the only place I can
Oh
be.
my
And so
goodness.
I've got a boiler at my head. But here we go. So there we go. Well, listen, I will come to the conference.
Thank
I
you, Evie.
I just think, I mean, we'll finish it up there because I think you have given such a great overview of why you're doing the work that you do,
Yeah.
the impact that the organization is having, on individuals and workplaces and health organizations. And I think what you're creating is helping us to support women, birthing people, and families, going forward. And I think, and you're so gracious with your time when you always come to talk about this. And this is a real passion project for you. And I think even though we've worked together quite a lot before, what was so important about doing it again this year for our 10-year anniversary, with the theme being a decade of voices,
Yeah.
it was built on lived experience. So I have
Yeah.
postpartum psychosis. Steffi's the other
Yeah.
co-founder, P&D. We've got Farah and Rosie, who talked about their own struggles as well, who are the members of PMHP. You have built this from personal experience. And I think we always say people are experts by experience, and we should
Yeah.
listen to those real voices. And so shining a light on the work that you're doing with your real voice and having a massive real impact has been incredibly important. So thank you.
Thank you. Thank you so much, Evie. Thank you for being such an advocate as well for neurodivergent women and birthing people. We really appreciate it. And again, congratulations on 10 years.
Oh,
Very exciting.
thank
I
you. I
hope
know
we
I
can
can't
get to
believe
that point.
it.